Hey everybody, Dr. Rouse here, just coming to you from the office, talking to you today about implants and the reason for getting an implant done. So future videos we'll talk about the different parts of an implant and a little bit more about the procedure, but today I just want to talk to you about why would you want to fill that space. So I've had quite a few patients who have had a space in their mouth for years, maybe even decades. And these are some of the things that I've seen done here in this picture, or I think this illustrates it really well. Or maybe just recently where they're having a tooth that needs to be pulled, or it just was pulled recently, and I'm trying to talk to them about what can potentially happen. So the main thing that you'll notice from this picture is there's no partner tooth for that upper one right there that has the red arrow. So if you have a space, you really need two teeth to be able to chew. And why does this matter? If you are missing one tooth on either side of your mouth, you're essentially missing four teeth to be able to chew with, right? Because you really need a partner tooth. So if you have an upper tooth and it has no lower tooth to chew with, then what happens is that top tooth can, droop down, or fall down, I guess you might want to say in layman's terms. The tooth behind it can tip forward to try to fill that space, and then you can have other teeth that break. So neighboring teeth, or sometimes front teeth, for certain people, it becomes a real slippery slope when you're missing a back tooth, and then you break off part of a tooth on the other side of your mouth, and then you think you're just going to rock it with with the teeth that you have left, and before you know it, you are home for the holidays, and that is the one day that everybody wants to get a hold of me, and I'm usually somewhere else. And so in order to avoid that as soon as you can with a missing space, consider getting something done to fill it before you start asking your other teeth in the mouth to do more work than it needs to. And the main analogy that I use is a football team. So if you have, an 11-man football team, and you're asking one of the, your running back to catch a pass, or you're asking your wide receiver to start throwing the football like a quarterback would, it just wouldn't work. So you don't want to go out and play another team with less than the number of players that you're allowed to have, right? So why would you want to do that when you're chewing food? You would not want to go out and continue to eat and eat and eat and have fewer than 28 teeth, ideally, to be able to do that with, right? So a lot of times we are able to get out wisdom teeth due to crowding and stuff, but that first molar, the one that's in the picture with the dotted lines, that is the first tooth for people to have root canal, filled, crowned, and usually the most common tooth to get an implant. The other most common ones that we see are, typical teenager, somebody falling and hitting their front two teeth, or just a front tooth, car accident, anything like that, and needing an immediate implant right there. So the ones in the back teeth sometimes get neglected because people go, I can live without that. But ideally, please give us a call as soon as possible. We do consults for implants. We can talk to you all about financing and pricing and stuff. Sometimes, we might do a virtual consult here or there, but ideally it's nice for you to be able to come in so we can get a really good x-ray, find out how much bone you have to work with, and stuff like that. So please give us a call, 972-885-9670. We look forward to hearing from you soon. Y'all take care. Have a great day. Bye-bye.